Welcome back, everyone. Today, our 12 News Water Watch campaign continues highlighting the importance of knowing CPR, building barriers between your kids and water, and of course, getting those little ones into swim lessons. Dr. Sonal Harter is here to talk about drowning prevention, something so important, and we just need to constantly be reminded of it. It's a problem 365 days a year. So just right off the top, what do we need to know about drowning and how common it is?
So it's very common and it's a preventable death, right? So we have about 4,000 drowning deaths per year. Number one leading cause for the ages between 1 to 4,
Right.
and 8,000 emergency visits for non-fatal drowning. So those are our current stats. And it's, like I mentioned, it's a leading cause for ages 1 to 4, and ages 5 to 14 is the second leading cause of death. So,
and you think about a teenager, well, maybe they've had swim lessons or they know how to swim, but that's not always just the number one default.
Right.
There needs to be other things in play to protect our children.
And if you think about location, it's bathtubs, it's in our house, swimming pools. So really, like kids under the age, babies under the age
Right.
of 1, bathtub is a common location for drowning. Also swimming pools for ages between 1 to 4, which
Sure.
we hear, unfortunately, so many stories about.
And telling people to remove the toys from the water if you're not going to be in the pool, or keeping
Absolutely.
somebody in charge of watching them. So we talked about locations. How about who is at risk? I know when we talk male versus female, there's some differentiation there as well.
So 80% drowning victims are actually males, and we think it's possible because of risk-taking nature. I know I have 2 boys, and they are
Yes.
definitely more risk-taking than girls. But also ages between 1 to 4, patients who have actually history of seizures or epilepsy, heart disease or arrhythmias are common, intoxication with alcohol.
Sure.
Or certain medications that actually can cause drowsiness. And a combination that I often see is someone who has had a glass of wine or 2 and is taking medications for sleep aid or
Just
anxiety.
enhancing
Just
both side
enhancing
effects.
those, absolutely.
Okay, so when we talk about preventative measures, a lot of people may think these are so obvious, but it's so important to continually hone in on them and what they are and what people should be doing.
Absolutely. So obviously having fence around your pool, and what I actually found during the research was 4-sided fences are better than the 3-sided fences. So that's actually more protective for drowning.
Okay.
Number 2 is making sure your doors have alarms if your child walks out, that you are alerted immediately. Number 3, making sure that the adults who are watching are not intoxicated, not drinking alcohol, that you have efficient swimmers around, that the deflatable tubs or, those little play pools.
Yeah, like the play pool that you might have for maybe a dog or something.
Like today, it's rained. Make
Right.
sure the water's all drained once you're done, or covering the toilet bowls at all times for little toddlers. So important. So I think these are some basic measures we can take.
And everything to prevent worst case scenarios, which we know the consequences of drowning can be very severe, and they can have lifelong
It can be fatal,
problems.
so life-threatening, but non-fatal can be brain injury that can leave someone in a chronic vegetative state. You can get some pneumonias, you can get some electrolyte imbalances, but also post-traumatic stress disorders. So non-fatal also have some complications with drowning.